The San Luis Obispo County Health Department is holding its daily news conference to provide updates on the coronavirus pandemic. Let's listen in.
By Dr. Bornstein. After that, they'll both take questions. Before I turn it over to Wade, I'd like to again remind local media outlets and folks watching at home that for the latest, current, updated information, you can tune in online to readyslow.org for the most current information, and we're updating that real time. I'll turn it over to Wade.
Thank you, Michelle. Wade Horton, County CAO and County Emergency Services Director. I'd like to start today with talk a little bit about what we're doing to protect the public. First of all, our shelter at home order starts at 5 o'clock today. We're doing that to maximize social distancing, again, to reduce the spread of COVID-19 and to keep our community safe. We're looking closely at hospital surge capacity so we can make sure we can treat the sickest of the sick if needed. As I mentioned yesterday, we were able to order and get a placement order for ventilators. We have 100 ventilators on order, and 30 of those will be here in between 7 and 10 days, and we anticipate another 70 coming in a couple weeks. We're planning for alternate care sites if needed. And again, we're working very closely with our tenant and Dignity Health partners to locate those sites in case they're needed. We're working with homeless serving organizations. So if we have a homeless individual that's presenting symptoms, we can get them isolated and yet still get them the care that they need on site at a shelter location. We're partnering with law enforcement. I've talked to the sheriff, and we've talked to the different city law enforcement organizations. And this is when that shelter-in-place order, when it goes in place, when it's effective, we can make sure that we have increased patrols in order to keep our neighborhoods safe. Another thing that we're doing is we're reaching out to our seniors and keeping our seniors and safe, and also make sure that they have the service they need is important to us. So right now we're working with the food bank, and today we should have an MOU signed. And we're going to coordinate with the food bank, and we're going to be able to deliver food and prescription medicine if needed to some of these seniors that don't have a support network. We're planning to use county employees and county vehicles in order to accomplish that mission. And this is, again, a way that we can take care of some of those folks in our community that might not have friends or family that are local that can help them out. I'd like to also update you on some current statistics. So as of today, we've conducted 232 tests at our lab. Of those 232 tests, we now have 13 confirmed cases of COVID-19. All individuals, I'm happy to say, are recovering at home. And to break down those 13 cases, 3 of those are on the coast, 5 of those are in North County, and 5 of those are in South County. As we test more, which is a good thing, we anticipate to see more positive confirmations of COVID-19. And as such, I just want the public to know that we're not going to be issuing individual press releases anymore for each additional case. However, we will continue to update the public at this daily press briefing. As I mentioned earlier, we are going to put the shelter at home order into effect today. And we've gotten a lot of questions over the last 12 hours regarding businesses and what's considered essential. We're going to be publishing additional guidelines at readyslow.org, and that breaks down categories of businesses, which ones are essential, which ones need to be scaled back, such as a restaurant that may be offering curbside delivery now, where folks can come up to a curbside and pick up food, and then which categories of businesses should or shall remain or be closed. With that, I'll turn it over to Dr. Penny Bornstein, and she can answer any additional questions you may have regarding specifics of what I put out today, and she can also add any additional information that she'd like to put out to the public. Thank you.
Thank you. Good afternoon. I'm Dr. Penny Bornstein, the County Health Officer. So with the information of the growing number of cases, I again want to reiterate that that is exactly what we expected. We expect to see, in epidemics of this sort, a doubling of cases within 3 to 7 days. And that's because the incubation period is that long, and so we will see more cases. So we'll be sitting here in another few weeks, and we may have cases in the, we'll likely have cases in the 3 digits, not the single digits, no longer the 2 digits. So that's where we're at. I want to talk a little bit about this shelter in place, as shelter at home, I'm sorry. So what I don't want people to think that this means there's a chemical or a radiological event that means you have to hunker down in your homes and never leave. You will see the detail that is being made available about where you can go, what you can do, but we want to encourage people to go outside by themselves or in family groups, get fresh air, get exercise. You can run, walk, bike, swim in the ocean, any number of singular, play across a tennis net. So this, there's a bit of a misnomer with this notion of shelter at home. It largely means that we are asking the public to participate with us in the enhancement of social distancing. So we don't want any situation other than for basic needs where people are gathering in groups of any size. Again, families can move about as groups, but we don't want to create the opportunity for spread between strangers. So again, that's in our restaurants, our bars, non-essential business functions. People can go to their medical appointments, and they should. Their routine medical appointments, as well as sick medical appointments for any reason of illness. We're asking, however, if you believe that your symptoms are consistent with this disease, COVID, as an additional measure of protection, we ask that people not just simply show up at a doctor's office, but call ahead. Because to a large extent, if the nature of the illness is mild enough to just get some medical consultation and be managed at home without bringing that person into a waiting room, be it our urgent care or be it your provider's office, that's the best way to manage that situation. Certainly, if the symptoms are such that it might lead to a need for additional care at a hospital, then hopefully that provider will make arrangements for that person to be seen at the right time in the right place. And that could even be in a parking lot. So when you're hearing call ahead for medical appointments, that does not refer to routine medical appointments. It means if you think that the symptoms you're experiencing, again, fever, cough, shortness of breath, fatigue and body aches, and particularly fever as the predominant feature with this disease, as well as cough, then please do call ahead rather than just show up at a medical clinic or a doctor's office. I do want to talk a bit about secondary spread, if I can use this again as a platform for people to understand that contacts of contacts are not worrisome. And the reason I'm bringing this to attention is because there is a lot of concern, understandably. As we see more cases, a lot of people are going to start to know someone who has this disease. And what we're hearing are, oh, but I work in the same office as the person who is the husband of, for instance, the person who's been diagnosed. So I'm going to use my colleagues here to talk about this. So let's say I have the symptoms, and it's been determined that I need to be tested for this disease. And I have just had a 3-hour working lunch with Mr. Horton where we were sitting right next to each other. He is now a close contact of a possible case. So I need to get tested, and I go and get tested, and he's worried that if I'm positive, I may have passed this to him. And that is a correct concern. He, however, then, the next day, has lunch with Miss Neal. And she now becomes worried that, oh no, I was in contact with someone who might have gotten this disease from me. She need not worry because he does not have the disease at this point. He may develop the disease after he incubates it for a period of time. Let's say I do become positive. He then becomes a close contact who needs a quarantine order to not go back to the workplace where he could potentially spread it as soon as he does become sick. But Rita is off the hook because it's transmitted once the person has passed their incubation period and is now sick. And that incubation period is a minimum of 2 days, a maximum of 14, but the vast majority of cases is more like a week. So if Wade did not go home and isolate, and he's still going about the county, and he has now spread it to a lot of people in that week, we've got a problem, which is why we're quarantining. But if he goes home on day one of, I may be a contact of a case, whatever interaction happened for him and others in this intervening time before he gets sick does not cause concern for the secondary downstream people. I hope a little bit of that dialogue and visual is clear. This is a challenging concept to communicate, but the reason I'm going into this level of detail is to help a large number of people in our community who are beginning to get very concerned about being contacts of contacts. With that, I want to reiterate what you've been hearing consistently, that we're all in this together. We are one big community. We have information resources available. We are going to continue to provide these briefings, and at that point, I'll just say we're open for questions.
Dr. Bornstein, can you talk about, you refer to a little bit the mental health aspect of this, because I think it's really starting to kick in right now, that people can go outside. Some people need shelter at home. I have to stay inside, and this is really starting to really mentally challenge people.
So I like a terminology that I saw from my counterpart of Los Angeles. A number of us health officers have been playing with language to try to communicate, what the risk is here, and they're using the term right now, safer at home. So I think that's really distinct from shelter in place. And what it means, this whole thing is about social distancing. It's about keeping people away from other people with whom they don't have natural, household connectivity. So it is not about shuttering our elderly in their homes, in their bedrooms, and bringing, and not giving them the opportunity to live life. So so people should go outside. They should go for walks. They should garden. They should do their landscaping. They just shouldn't do it with strangers. The higher risk groups, we have actually said, try to avoid going. If you are going to go to the supermarket, go at a time of day where you're not going to bump into other people. Keep, even within that grocery store, if you're a vulnerable person, keep your distance from others. But this really isn't about there's something in the air that by virtue of you leaving your house that puts you at risk. It is simply stay away from people who can transmit the disease.
Dr. Bornstein, the new cases, can you talk some of the specifics about the ages, and then out of all the 13 cases, how are everyone recovering after this point?
Yeah, thank you. So all 13 individuals at home. The newest cases I don't have a lot of information on because 3 of those newest cases came from the private labs, and I'll talk about that in a second. But all 13 of our cases are home, at least in a couple of cases. They appear to have fully recovered at this point. We are not doing repeat testing to ensure that they are free of the virus. New information has come out from the Centers of Disease Control that they're is a new way that we can allow people back into society, and that is, so the original cases in the United States, all of them were being tested every 2 days with the same lab test and making sure that they came up, negative. At this point, we're saying that 72 hours of no symptoms and at least 7 days since the onset of illness would allow someone to be considered cleared. You had a second part of your question about how are they doing, the 13. Okay, if I answered your question, thanks. Sorry, I felt like.
I have a lot of questions.
Thanks, Monica, you're good.
Thank you so much for all your information. It's been very clarifying on several issues, and thank you for your hard work also. As I said, I have several questions, but we are really hoping that at some point soon we can receive more public information about the individual cases, including their age range, if you don't want to give specific ages, as well as what town they're residing in. And in addition, we're hoping that you can provide some insight as to how they got the disease, if it was through community spread, travel related, or otherwise.
Right.
Are you going to be able to release more detailed information?
To some extent, yes, and that was the other part of your question now, is what the ages are. So only, so one of the individuals was in their 20s, and I do not have the detail on all 13 cases. I think I have it on the first 10. All the others, I don't have a number breakdown, but we will start, as our case numbers increase, we will start doing the same thing that you can now find on the state website, which is number of cases by age, and they just break it down by are above the age of 65, are they 18 to 64, or are they below the age of 18. So I know that in the 18 to 64 age group, I am aware that 3 of our individuals fall into that age category. I am aware the other 7, I believe, fall into the above 65, and I don't have the information for the most recent ones. But it is following the patterns that we expect in terms of age distribution. And with the youngest person, we had one person in their 20s, and I do know that was an international traveler from a highly endemic country. The others that are in middle age, not above 65, do have significant underlying medical conditions. So the categories that you will see is, and soon this will be dropped, but returning traveler. So, and the reason I say that will be dropped soon is because you're now perhaps as at risk in our own county as some other places. But so if we know that there was a travel history outside of our county that's consistent with when they contracted the disease, we're calling them a traveler. If they had household or close contact spread, we're calling that person to person. And then we're everyone else for whom there is no travel or direct contact to a positive case, we're calling those community transmission. So again, you will see those number breakdowns. I actually can't do it now on the top of my head, but we will provide that. As to the geography, we have decided to not go beyond the region level. All of our contact investigations thus far have yielded information that during the period of concern, starting even before disease onset, our detailed investigations lead us to determine where that person's whereabouts were during the infectious period and to notify all of the people who may have had the close contact that is of concern. So I will again say, as I did the other day, that for reasons of medical privacy, as well as to try to manage public panic and not say, this was in Shandon, which is a small community, versus Paso, that we would like to keep it to the regional level.
Several medical providers have told us that they don't have the supplies or information that they need to respond to this emergency. I've talked to 5 medical professionals at state hospitals, at urgent care centers, at private practices, who have all said that they're short on personal protective equipment and kits for testing. And others have told me that they want or need more direct communication from the public health department. So how can you respond to those concerns?
Yep, very good questions. So as you know, this situation has been changing very rapidly, daily, hourly. The last 24 to 48 hours, I have gotten additional medical staff on my team that are working on information materials as well as a webinar for private providers in our community. We very much want to support our community practitioners in giving them what they need, both in the way of an understanding of how to manage this disease as well as the material they need to do so safely. On that latter point, we are getting a large number of resource requests from providers, and we are doing our best to meet those, but there are some areas that are becoming increasingly difficult to get in terms of protective equipment, in terms of laboratory supplies. And we will just keep making those requests and make sure that we get whatever we can as soon as we can get it and to provide it to our medical partners. Those are some of the areas of challenge. In terms of the information flow, that is one of my number one efforts in the last 24 to 48 hours, and ongoing to provide the informational support to our providers. One other thing that's happening tomorrow is a call that I'm having with several hundred physicians on a teleconference. So we're doing a lot of things in that regard.
Okay. When you say requesting PPE, for example, who are you requesting? Who are you waiting on? Where is the
right?
The
So in the state of California, for medical supply, we have a system that's called the RDMHC, which is Regional Disaster Medical and Health Coordination, RDMHC. And so for our region, the person who's the lead of that function actually resides in Los Angeles, but our medical and health branch in our Emergency Operations Center has a direct line to that person to make those requests. And if they can't be met, so if they can't be met in our county, they go to this region, and if they can't be met at the region, they go to the state, and the state in turn goes to the federal government. But that entire chain is not able to keep up with the demand.
I have a question. So most of these cases so far here in the county, you mentioned over 65, but I know the CDC has some new evidence that young people, 20 to 44, are the growing population of carrying the coronavirus. Do you expect those numbers to change? And what have you also been seeing with young people populating in this virus?
Yeah, so I think, so adults of any age has consistently been a population that is getting this disease in other countries in large numbers. It's the older individuals, as well as those with medical conditions, who are having the most severe cases of disease. As the testing expands, I anticipate that the majority of people who actually contract the disease may well be in the non-senior age group, the 18 to 64. I think that's what we're beginning to see in the state of California and elsewhere. As we begin to test more people, we will get a true picture of who's actually getting the disease. Everything that I have continued to see, and I haven't had the ability to read all the research articles on this, is why children under the age of 19 actually seem to not be getting the disease. Not just that they are having mild cases of it, or maybe even asymptomatic cases. What is believed today, until we have a serology test where we can test everyone, it appears that children are relatively spared from actual infection.
Question for Wade. When we continue to see people, I guess, ignore some of the orders, still congregating in groups, naysayers, perhaps you could say, this is not heeding the advice that's being given. Your message to those people and just the community at large, as we're about an hour away now from the shelter-at-home order, as we get ready to head into that, the message is for those people.
I would say do what you need to do to protect your grandparents. I mean, this isn't just about you, it's about our community. And in order for us to accomplish the goals that we've set out with this order that's going into effect at 5 o'clock, I know it's hard. I know, and that hard isn't even being to describe it. It's incredibly challenging. But in order for it to work, in order for us to be able to slow the infection, or the disease, so we can take care of the sickest of the sick among us, we need to all do our part. So don't be selfish. Do what's right. Do what's right for the community.
And again, we're about an hour away. Your message to people would be this, as you mentioned, heed this advice, continue to listen to what's happening here today.
Right. We're not taking this lightly. We know this is a very difficult time for everybody. We're going to reevaluate these measures in 2 weeks, and in consultation with Dr. Bornstein, when we will lift this as soon as we can, because we know the incredible disruption it is to not only to people's lives, but we understand this is what's happening to people economically. I mean, if you're a small business owner, I feel for them. And this is going to be incredibly challenging, not just the stress of a pandemic, but also the stress of a business that you see you can't continue to operate. It's a very difficult time. But what's important, again, is in order to get back to normal as soon as we can, we got to come together and do it and take the actions we need to take now so we can protect people, and we can get back to normal as soon as we can.
Penny? Thanks. Can you tell a little bit about the testing capacity right now, both for your department and countywide, if you have any insight on what the private sector can provide, and do you have any outstanding test results, and are you monitoring, any residents for potential testing?
We are testing every day. So we will have additional results by tomorrow. We are a passive recipient of positive-only results from the commercial laboratories, and that's why I cannot tell you how many people have been tested. I do not know what the negative results are from the private sector of laboratory testing. We will continue to work on getting that because I think it will be important for people to understand what, how many people who are presenting with this illness are actually have the illness versus those who have similar symptoms but have something else going on. I can tell you from our laboratory, you heard Wade say it, we've done 232 tests. If of our 13, 4 or 5, let's say 5, came from the private sector, so 8 out of 232 tests done by us have been positive. Did I fully answer all aspects of that question? Okay.
Fair enough.
All right. Thanks.
I know I can't ask every question that we asked our readers if they had any questions, and we got 125 in 10 hours. And I've tried to categorize some of them, but one thing that I'm hearing over and over that maybe you can answer is people want to know if they can go visit their parents, have meals at their neighbors or friends' homes. There's some confusion about how much we need to isolate from each other in small groups within our home. Can you kind of talk through that a little bit more?
Right. So household transmission is the most common way of getting this disease. Those are people who live and communicate in the closest settings, and therefore it doesn't make sense that if you're sitting around a dinner table in close proximity, or literally, dare I say, in bed in close proximity, that we then need to say, but when you go outside, you may not touch each other. So households can continue to function as households who have close contacts with each other, whether it's in their home or outside of their home. If it's individuals with whom you do not have a daily close communication with, like you get together with your friend every Saturday for drinks or in their home or whatever, we would recommend that you do not continue to do that kind of socializing. with respect to visiting grandparents, visiting, bringing together families for Easter dinner, we're not going to be policing that. We ask people to take best precautions, to recognize who the highest risk people are. So it may make sense. If grandma's not in a nursing home, but she has some underlying conditions, then maybe she does need to be fully isolated. We have gone to the extent, absolutely, in people who are quite ill and or elderly and live in long-term care facilities, we have actually said that there should be no visitation in those situations. Short of that, families coming together within homes, my advice is to please use your best judgment based on the risk characterization of the individual family members. But socializing across family units, we are actually recommending that cease to happen.
Thank you so much. That provides a lot of clarity. I think you made kind of a joke that you won't be policing that. Will the county be policing or enforcing this order in any kind of way,
And
aside from recommendations?
I'm going to turn that over to Wade.
So again, based on previous comments, this is if we're gonna do what we're trying to do here, the community has to come together and get it done. We can't do this as individuals. If it's going to work, people need to comply. So is it a misdemeanor? Yes. But do we need to get to that point? If we have to, we will. If there are folks that are flagrantly violating, they're having they're gathered 50, 100 people, and they're not paying attention to this. Will we have a peace officer go out there and ask them to break up? We will. But the intent isn't to go around issuing citations. The intent's to protect our community. And I ask everybody that's watching this that we do that. So again, we can get back to normal as soon as we can.
Also, another question. We've also been hearing from some viewers wondering with the shelter-at-home order in terms of Airbnbs, people continuing to rent out. People still rent out their homes. People still come into the county for these purposes.
So again, we're going to be issuing a list. If we haven't already, it may have already gone live during this press conference, and the different categories of businesses will be that we're recommending be closing, and those that can remain open or be scaled back will be on there. In regards to Airbnbs, there may be individuals in our county who want, if they have someone who is at home and they want to isolate from that individual, we're trying to leave all options available for them to stay local, but at the same time do what they need to do, what they feel they need to do to protect their families. So Airbnbs, I believe we are allowing those to maintain operation along with hotels and motels for that reason. But we certainly, the intent behind that, though, is to provide opportunities for the citizens and constituents of San Luis Obispo County to have options to take care of the health of themselves and their families. Thank you very much.
Thank you all again for coming today, and thank you especially for all your thoughtful questions. I know you're doing your best to get all the right information out to the public, and we appreciate that. I'd like to close again with just a few final reminders. Again, as I mentioned earlier, all of our information is being updated real time on our emergency response website at readyslow.org. We also have 2 phone numbers that you can use to get additional information. The public health information line is available 24 hours a day, 7 days a week, and it's a recorded message. And that phone number is 805-788-2903. And then we also have a county phone assistance center set up, and that's where you can talk to a real person and get your individualized questions answered 7 days a week, 8 a.m. to 5 p.m. And that phone number is 805-543-2903. 2444. And I'd just like to close again by saying thank you and letting you all know that we'll be here again tomorrow afternoon at 3:30. Thank you.
And that is San Luis Obispo Public Health wrapping up its press conference today. Here's what we've learned. What they're doing to protect the public. As we've heard, the shelter at home starts at 5 p.m. today. And this is to maximize social distancing and to lessen the impact of the virus and to stay at home and to protect others as well. As far as supplies go, 100 ventilators are on order, and they will arrive in about 7 to 10 days. And another 70 are also on order, and they are expected to arrive in a couple of weeks. During the shelter at home, which again begins at 5 o'clock in just under an hour, the county is partnering with law enforcement for the order to have increased patrols to keep our neighborhoods safe. They are also reaching out to seniors. They're working with the food bank to be able to deliver food and deliver prescriptions for those in that vulnerable demographic who don't have a support network. They don't have family nearby or friends nearby to be able to do that for them. They spoke about current statistics. As of today, they've done 232 tests in the county, and of those tests, there have been 13 confirmed cases. Those cases are recovering at home. What we know about those cases, there were 3 confirmed on the coast, 5 in North County, and 5 in South County. And those numbers will be updated daily to the public at the daily press briefings. Again, those cases, they didn't go into specifics, but we know that 3 of the cases were the patients were 18 to 64 years of age, and 7 of those cases were above 65. The youngest person was in their 20s, and that person, we're told, traveled internationally. And due to medical privacy and to manage public panic, they will keep specific locations private at this time. Again, the shelter at home, Dr. Penny Bornstein, the SLO County health officer, discussed as they do more testing, and they do more testing every day, they do anticipate this number to increase pretty much triple, they said, in 3 to 7 days after the incubation period. So they do anticipate a larger number just within this next week. So we do expect those numbers, and we will be updated daily at these public briefings. And just to enforce the order of the shelter at home, they did emphasize that it will be a misdemeanor if the public are flagrantly violating the order, if they're gathering in places of large groups and dismissing the social distancing recommendation. But the intent is to protect the public and not to issue these citations. They want to do what is best for the community. And we'll have full team coverage of the impact of the coronavirus that it's having on the Central Coast coming up tonight on News Channel 12 at 5 and 6 o'clock. We'll also continue to carry these news conferences every day live and in their entirety. You can watch on air and online, and we have a special section on our website dedicated to the coronavirus where you can read the latest updates and find local resources. Just head to our mobile app or kcoy.com/coronavirus. We'll see you at 5.